face up with your head at this end. Okay, super quick review. So we did ilium, checking leg length. This is slightly longer on the right, so long lateral.
Nice flexibility, huh?
Yep, it's got good range. Pubic bones high on the right, bend your knees. Push them out. Pull them together. Good. A little bit, not much.
Yeah.
Let's go for the alternate. Give them a little stretch on this side. Don't push yet. And just a slight push. Relax. Again. Relax. One more. Relax.
He's pushing up with his knee.
Yes, he is. Very lightly, like I asked him to. Okay, still got some change. Bend the knees. And then we ischium. Yeah, right side a little higher. And we did just a straight drop. Whoa. Let me go other shoulder.
Excuse me.
Relax your hips. Quick bend. Very slow, flip over face down, sacrum. Brings us to the end of the pelvis. Check the ilium, L4, L5, S1. Right side's very depressed, left side's high. So remember when he was flipped over, this side is kind of pushed this way and this side's pulled back, and that's why all that stuff showed. I would bet as soon as we do this sacrum, go ahead and prop up on your elbows. Relax your pelvis. Beautiful. As opposed to holding, I'm doing just a little bit of rocking. Expedite things a bit. There we go. Finger just dropped in about a 1/4 inch. It's a good sign. And slowly let yourself back down. And he's got a little bit in that hip. Sacroiliac. So bring that side out. For him, I don't need the bolster because there's enough residual tension here that just this position is making his SI joint rock. Good. Now it's rocking nice and open. Okay, William, flip face up again for us. We still got his pubic. Something's going on there. We'll check it out later. Okay, so that's review the pelvis. Now we go to lumbar. The top of the iliums to the bottom of the ribs. Okay, that's our lumbar section. So all we're going to do at first is just palpate soft tissue on either side of the spine. See if we feel the same thing on both sides. She's got extra tension on this right side. You can feel it in the muscle and in the fascia. And then I get closer to the spine. Still a little bit more on that right side. Okay, so the first one listed for lumbar should say leg swing. Again, leg swing is by far the subtlest of all the lumbars. We saw there was extra tension on the right, so her leg swing goes to the right. Okay? And then all I'm going to do is a little bit of rocking and rolling on that right side. So what did I do? When I swung the legs here, what happened to the spine? It arched in towards this side. So there's a little concave section of the lumbar on the right, and there's a convex section of the lumbar on the left. Okay? So all I'm doing is taking this excess and massaging it towards the open side.
So how do you say bend body and shake towards the open side?
Bend body and shake towards the
Bend the
open
body
side.
towards the left side. but
Towards the,
then
yes.
Shake towards the open side.
You got it.
Okay.
How do you come with the shake? All right.
Or rock. Rock. You can substitute the word shake for rock.
Okay.
What are they shaking that day? There's about 150 different hand techniques in TuiNa. Rocking, rolling, tugging, pulling, pinching, wrenching, scrubbing. There's a whole bunch of them. To me, if you have rocking and rolling down, you can add any of the other ones into it. And someone was just saying that they kind of felt like, you know, sometimes when they do just TuiNa hand techniques, they feel like an inexperienced massage therapist. But if you get good at just rocking and rolling, you can have little experience, but the person on the table is going to think you're an expert because it's going to feel great to them. So that's the really important thing about massage, right? Is that the person's, you know, feeling good. So. Okay. And then we bring her back to straight. And then we can check again. See now both sides feel pretty even. Now this, if it was just soft tissue, great, the soft tissue's open. If it was soft tissue and fascia, which I could feel a little fascia before, now it's pretty open. Okay? If there was structural bone-oriented manipulation to be done, would that have gotten done as well?
Probably.
Yeah, sure. If you open this side up and there's bones that need to move that way, your rocking is going to assist them straight back towards the center. Okay, so very, very subtle way to deal with the lower back. Okay, everyone's always wanting to grab, twist, and do all these things, but sometimes you just need something real, real subtle. And especially if the person's coming in from an accident, you're not going to get to do number 2 or number 3 that we're about to do because they're just not going to be able to handle that range of motion. Almost anybody in whatever amount of pain, if you can get them to lay down, you can swing their legs a few inches to one side and you can rock. So it's something that you can even do if the person's in severe inflammation and pain. Okay.
What if both sides are tight?
What if both sides are tight? You could do both sides, sure, leg swing to both sides. It's going to take you twice as long, but yeah. You do see that sometimes, but more often than not, there's a pattern one side or the other.
How far over did you swing her legs when you showed them this side?
Very, very small.
Oh, I thought it was over the knee.
Okay? That's it. Real, real small. You're just looking for a small arch. That's it. Okay, so that's face down. I think number 2 is probably lumbar roll. We're going to go for number 3. Thank you very much. Another volunteer.
So sports lumbar.
Yep, that's the one we're going for next.
Thank you.
Face up.
Face up.
Okay, sports lumbar or lumbar stretch.
Chad, kick her shoes in so you don't trip.
Thank you.
Sorry.
So first, stretch straight up. Okay, if they have knee issues, keep the knee out of it. Push the leg up. Straight out from her opposite ilium. Not up here and not down here, but straight out from the opposite ilium. And cross the knee, straight across. Just got good flexibility there. I'm just holding her shoulder down as an anchor and pressing across with my hand. Back, and before I straighten her leg out, I give her another push up. And then straighten out. Same thing on the other side. Straight up.
What if you hear a lot of cracking?
That's fine. What's cracking? What's that?
Release
What's
of
that?
nitrogen
What's
gas.
that?
Release of nitrogen gas. Could also be cartilage rubbing against each other. Could be a ligament rubbing against the cartilage. If you guys if you were really quiet and you listen to me walk around, you're going to hear my ankles crack all the time. Just, injuries from basketball when I was in college. As long as there's no pain with any of your joint noises, you're doing just fine. If you start to get pain with your noises, then then there's some inflammation building up, and you gotta take a look at that. Straight out from the opposite ilium. And straight across at the knee. Anchor the shoulder and twist. And as you come back, before you let the leg out straight again, just give it a slight push up and then out. Okay? So this is a real generalized, what I call opening for the lower back. Okay, it's definitely got your 2 primary stretches that you need. You definitely need the knee to the chest. Anybody with a back injury that's been to any type of orthopedist, they're going to probably have them do those exercises every morning in bed. Pull your knees to your chest, one side, the other side. A little stretch to the outside and a little stretch across. Okay, so this is just kind of a short TuiNa way to kind of do that same thing for the lower back. Okay. And it's good for face up. Okay, so if the person's there, if you're already doing other things, or if you've maybe you did treatment for their lower back, then you flip them over, you're sticking some needles in the front, they're finish off everything. At the very end, you could always stretch out their lower back if you need to. Okay. Thank you very much. And one more volunteer for the last lumbar. Facing me, I'm going to ask him to scoot just a little towards the edge. Perfect. We're going to straighten out his bottom leg, and we're going to bend his top leg. Okay, to whatever he's comfortable. And notice I bent it, and then I let it lay against me, so that I don't have to mess with it anymore. Okay. This was called a lumbar roll. Sometimes they call it the $1 million roll. Sometimes they call it the chiropractic roll. It's what the chiropractors make their millions of dollars with. So we're doing it as a TuiNa manipulation as opposed to chiropractic adjustment. When they do it very specifically, and you can hone in on any one specific vertebra that you want. When we do it as a TuiNa manipulation, we're doing it to open the whole lumbar spine. Okay, so it's not as vertebra specific as, say, the chiropractic or osteopathic roll. His lower body's already set up. Notice how it's twisted and rolling this way. We just want to get his upper body going the opposite way. So I lift and he gives himself a little hug. Okay? Now if you notice, his lower body is in this arc, coming towards me. His upper body is in this arc, going away from me. Okay? Take a nice deep breath in and out.
Nice.
Okay? And I'm going to put this foot just behind. The second one, all I have to do is push down on the knee. And that was sacroiliac action. Nice and slow to the other side. Same process over here. Bottom leg goes out straight. Top leg bends slightly. And this is the same position. When you're laying in bed, you're like, oh, I need to stretch my lower back. You put your leg across, kind of try to get that same stretch. So it's exactly the same position.
Bottom arm needs to be on top, huh?
Yes, and that gives you a better anchor. Now, there's 100 different positions, and that this brings up probably the best topic to talk about in terms of positioning. I actually don't recommend that any of you use the same positions that I do. The positions that I use are for my little long body with long arms, and I've been doing this a long time. So what you should do is you should conceptually find ways to do the same things that I'm doing with your body. Okay? Case in point, you could just put both of these hands right here on his rib cage, and you could use this to twist, and you could use that to pull. I could put this through here and have him grab his wrist, and then I can go like this and use his upper structure that he's kind of creating a base with. There's a whole bunch of different ways to do this, but the concept needs to stay the same. Okay? This leg has to go this way so that his hip is rolling towards me. This part of his upper body needs to be able to roll that way so that it's going opposite the hip. Okay? If I can get both those things to happen at the same time, nice deep breath, and out. Good. 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 And now we'll just do one more, relax here. Good.
And then you
Face
put
up.
his foot behind his leg for the first one?
I did. Yes. Beautiful. Okay. So we did a face down lumbar, okay, which was the leg swing. Okay, whichever side you feel is affected in the lumbar, you swing the legs to that side and you massage it out towards the other side. Okay? Face up, we did sports lumbar, which was 3 stretches. Knee straight to the chest, knee straight to the side, and knee across. Okay? Now the across stretch, here, here, doesn't that look a little bit like the last one we just did, the lumbar roll? Right, it's very, very similar. Okay, the only difference is that his whole back is anchored on the ground, and I'm just stretching the hip across. Okay? In the actual lumbar roll, the spine's not anchored, right? The spine is twisting. The whole spine is twisting. So it's a little bit different. The one, if I put them in order of subtlety to vigorousness, leg swing, lumbar stretch, and then lumbar roll last. Okay, lumbar roll is definitely a vigorous stretch, but it's also the same thing. If your back is feeling tight, what does everybody do?
They stretch, yeah.
You know, right? You start trying to stretch your waist out. It's exactly what those lumbar rolls are. Okay, you're just helping them do that same type of range of motion. And those of you who've done my Qigong warm-up, you see us do this all the time, right? Right? Hands are always swinging in these waist turns because you're trying to get that same range of motion in the waist twisting. Okay? John, thank you so much. Appreciate it. Okay, so lumbar. Lumbar feels good? Everybody kind of understands lumbar? Okay, I need a volunteer for thoracic.
Well, I'll volunteer. Oh, yeah.
Hold on, there's a couple more.
Here's one.
Robert. Let's start with Robert. And we'll go face down, Robert.
Take your phone out of your pocket.
Take it off.
No, just a phone. A phone.
There's a phone.
What's in,
Oh,
what's
that's
in
about
bags?
Yeah, that's all.
He's fine.
That's all.
We're up here at thoracic. Okay, so we start thoracic face down. Same type of palpation. Remember we were here looking at the both sides of the lumbar. We can obviously do that the whole way up his spine. Now, when we get to this thoracic section, and again, I talked with chiropractors, osteopaths, and all of bone manipulation doctors, and they all said different things. They said, well, if you're going to look at thoracic, you should have the arms up. No, if you're going to look at thoracic, the arms should be hanging at the side. No, if you're going to look at thoracic, they should be down next to the body. I will say, in my opinion, over time, I think that down next to the body is definitely the most neutral place to look at the thoracic. Okay, because it takes all the ribs, it takes these muscles, which if you're here, you feel these muscles and there's a little tension in them. You put them up here, everything's totally relaxed. Okay, so I like to get as many things out of the equation as possible. Okay, so putting the arms next to the body really just gives you the thoracic spine and doesn't really complicate it with a lot of other stuff. Okay, so now that his hands are down, I can really palpate the whole way up. He's got a little extra tension in his right side. Spinous processes. He's got a couple that are facing right up to about here, and he's got a couple that are facing left in the middle. The bottom seems to be about the best. He's got a good transition from his thoracic into his lumbar. So Robert's doing something right.
Give me something wrong, I have a scoliosis that will just
Okay.
show you the difference.
Listed first on thoracic should be maybe thoracic crawl. Okay. We'll do thoracic crawl, then we'll do arm swing. Actually, let me do arm swings first because that'll make more sense. So same thing we did with the legs, you can do with the arms for thoracic. So I said there was a little more here on this right side. So I'm going to take his arms and I'm going to swing him just a little to this side. Okay? And just so you can see, you don't always have to be on that side. Now I'm on the opposite side and I'm pulling this way. I could be on this side pushing that way, but I can also...
But you work the tight side.
Exactly. And you work it towards the other side. And there we go. Fascia's starting to open. Okay. And then we bring him back to the center, and then we flip his arms back. Okay, now my fingers can actually get into that right side. Much better. Okay, so same concept as the arm swing. The right side of thoracic is tight, swing to the right, massage to the left, or vice versa. Second one is thoracic crawl. Kind of like the sports lumbar, which was kind of more of a general way to stretch and open. Thoracic crawl can be similar to that. We're going to start at the bottom of the thoracics, and my hands are going to do this. Kind of circular pressure in and past each other. He takes a deep breath in and out. Good. Another
How much
deep breath.
pressure are you applying?
Moderate. Nothing too heavy. And out. Good.
So you're doing both sides?
Yep. Both sides, both directions. All right. So we got about 2 or 3 there. Wasn't any osseous pops, so I don't don't think anybody was going to hear anything, but there was definitely some shifting and some movement. He's got one more right here, which is going to make him a perfect candidate for number 3, which is thoracic compressions. Okay. Robert, go ahead and flip over, face up for me.
Is that the same as sciatica?
No. Sciatica is down here in the pit. Yeah, so we're up in the thoracics. Okay, so he had kind of a mid-thoracic, I was going to guess, maybe T7, T8, somewhere around there, that seemed like it was being a little stubborn. Everything else around it opened up, the musculature around it opened up, so it's, it's primed and ready for manipulation. So far we haven't done any direct manipulation into the thoracic. We've kind of generalized in that area, but nothing specific. So this is the first specific one for thoracic. And it's at the same time, it's one of the easiest manipulations and it's one of the most difficult manipulations. It's one of the easiest if you relax and you let yourself do it. It's one of the hardest if you get anxious about it and, and kind of start to tighten up. So it was a little bit on his left side. So when we position hands for thoracic compressions, we want to put the opposite side down first, and then we want to put the affected side on top. Now what does that do to his arms? It makes his left arm do what? Stretch more, right? And that means it's going to have a little bit more pull on the left side. Moderate, but still a little bit more. Then I'm going to roll him towards me, and I'm going to find that spot in his back, which should be right about here. Now, when I find that spot, I take my hand and I make a little cup. Okay? It's almost like I just roll my fingers in and make kind of an open fist that has a little pocket right there. Okay? And that pocket is going to cup that vertebra. And then I roll him onto my hand, and I keep this right here on top of his chest. Because now all I need to do is compress towards his other hand. Deep breath, and out. There you go. One more, deep breath, and out. There we go, and last one. Thank you, Robert. There you go. Okay. So all I did was I started down, I think it was one below where I wanted to be, and then I went up, and then I went up. So I just kind of went through that range. I don't find bones as specifically as I know a lot of the chiropractors I work with do. And so a lot of times I just let myself a little bit of leeway. If I start here, I can go through that range as opposed to trying to hone in on it right on the first time. Because if I miss it, then I'm going to have to move anyway. So I always just kind of let myself kind of float through that area. Thank you, Robert. We'll borrow another...
When you were folding his arms up on top, you have the affected arm on top, and you're pressing more on this.
Yes. Yes, because if you look at my back, if I put my left hand first, and now when I go to do my right hand, what do you see my right scapula do? It's stretched way out, right? Because it's on top. It's being forced to stretch more. Okay? So, thoracic compressions again. I'm going to have her just cross random for now. When she rolls to the side, and now I can check and palpate. Okay? I can start up here at the upper thoracic, palpate the whole way down. You tell me why most women have thoracic issues right where their bra strap is.
Because of their bra.
Constriction.
Yep.
There's more she's stagnation right there.
Are you looking for lateral deviation or are you looking for convex concavities?
Both. Both. Mostly lateral deviation though. Okay, so there's my spot. There's my cup. I roll her onto my cup. And now I need her to switch. Let's put this one first and this one on top. And give yourself a deep hug. Yes, there we go. Now notice how that gives me a good spot of pressure. If her arms are out here like this, there's nothing for her to really push on. So I need them kind of in here together so that everything's going to get pushed into one unit.
Okay.
Okay? And I have her roll onto her back, nice and flat. Deep breath in and out. There you go.
I have a question.
Hers had an osseous pop. Anybody who was here in the front row, you heard the osseous pop.
Yeah.
Okay?
That's not true.
Whoever I worked on just before this, who was that? Robert. Robert didn't have any osseous pops, but he had two that moved. So, again, that goes to show you you're not always going to get noise, and don't always look for noise, because then you're going to sit here all day and you're going to be like, it's not working. Why isn't it working? It did work. Okay? All you have to do is feel if it's different. If it feels different, then you did your job. You don't need the sound. Go ahead, Julie.
The bottom hand, the cupping hand, are you doing anything with it, or are you just kind of waiting for that
Nope.
vertebra to come down?
It's totally dead weight and relaxed, and you're just pushing into it.
And which side of it are you on? Are you, when you put your right hand over her back, are you on the right side, the left side of her back?
Center.
Right in the middle?
Right in the middle.
Cool.
Right in the middle. One tool that I've seen people use, when you have a massage table or a treatment table like this one doesn't matter because it doesn't bother your hand at all. All these tables are nice and cushiony, and so you can put your hand under there and you can push into it. It doesn't bother your hand at all. Try this on the floor, okay? Or try it on a towel or something like that. You're going to feel like you break your hand every single time you try it. So what I recommend sometimes for people is, if you have a soft surface, always try to use a soft surface, because then you can do your normal technique and it's not a problem. If you don't have the option, if you're on a flat, hard surface and that's all you got, then what I suggest you do is you either use a rolled up washcloth or a half a ball, like a half a tennis ball or half a racquetball, or any ball that you have, you can cut in half. And then you take that half of the ball and you cup it underneath that part of the vertebra, and then you can just let that sit there. You don't need anything underneath of them except for that. And then all you do is push straight into the ball. Okay, the ball will do all the work for you. Again, I don't like that as much as my hand, because my hand can feel. Okay, the tennis ball is not going to tell me if something moved or manipulated. All right, I'm going to have to move her, take the tennis ball out, repalpate, go through all that. Okay, it didn't work. Go back, try it again. If my hand's there, I know whether it worked or not right away. So we always like to use the hand if possible, because again, we have sensitivity with the hand. But if your hand's going to get hurt because you're about to do this on concrete, then you have to kind of, you have to kind of think of some maybe different ways to do it. Okay? You take a washcloth. See if somebody has something about the size of a washcloth. If you have a washcloth, you roll it up really tight so that it's in a long, thin tube. And then you wrap the tube around your thumb, and so that it's basically a circle with your thumb through the center of it. And then you put that circle wherever the vertebra is. Okay? And that'll work as well. Okay? Those are tools. Again, you'll hear me all the time say, stay away from tools. If you can't do it with your hands, there's a problem, because you might only have you, the person, and your hands. And that's usually what I have when I'm out and about and needing to work on somebody, is I just have me. So if you rely on tools all the time and you don't have them, then you're not going to be able to do your stuff. Okay? If you just rely on your hands, then you're always ready. Okay? Thank you very much.
Chad, can you show me one time how you're rolling the spine, because I can't see?
Sure, one more.
If you
One
do
more
it on the other
volunteer.
side, they'll be able to see it.
One more volunteer.
I'll do a check.
Come in.
Okay, normally when you do that, right now everybody's a flexible, you cannot cross right here. But if you don't have a flexible like that, how do you do it?
Yes. Face up. Okay, so we would like to be able to do this to Nancy and get her elbows over each other. Okay, sometimes because of maybe even trauma, sometimes shoulder trauma, I can't put people's arms in this. So I can give her just a little hug like this and use this part of her forearm. Okay? If I can't do any of that, I can put her hands right on her center line wherever I feel the thoracic change is. So if it's upper thoracic, middle thoracic, or lower thoracic, and that way I just use her hands as the base. Okay, that's fine too. Nothing wrong with that.
Do you have
Okay.
to breathe when you're doing that then, so that they're exhaling when you're
Yes,
pushing?
always exhaling when you're applying your force. Okay? And even in the upper thoracic, even this one, I'd say the highest I can get is T4 at the most with this. But if she interlocks her fingers and puts them behind her neck, now I can go the whole way up to T1. Okay? Because now I can push straight through. Okay? I had somebody who I needed to adjust T's 1 through 4, and I was having a lot of trouble because they had a fractured elbow that they couldn't bend this far. I would say the most, I'll let this one out, like, yeah, that was about as far as they could get it. And so what I did was I actually had them put this hand next to this hand and see how I still end up with the same weight of press.
Just the press down.
Straight down. Straight down.
Like you did with the leg, yeah. Okay.
Exactly. Okay? And then my hand will be cupped back on whatever I'm feeling in the back. Okay? So for Nancy, I'm actually interlocked again, and let's get you a comfortable position because you don't have any of these elbow problems. So now I'm up here, top of her thoracic, and she's got just a little bit on this side. So I'm going to cup right here, and roll her onto it, and slight pressure. Deep breath, and out.
Can you do it from the other
Okay.
side? Can you do it from the other side?
I can.
Please.
I'm not going to apply the pressure again because
That would hurt her.
she already
Let's
cleared.
see where you're at.
So there's my cup. Go ahead. My position and drop. Okay?
Thought your hands were workout.
Nope. Very, very loose. Very, very loose. Yeah.
So if you have someone with,
Thank you, Nancy.
you know, I have 85-year-old people with severe scoliosis that their rib cage are worked,
Mhm.
plus they have osteoporosis. I don't know, it's gentle, just do it real gently.
Just do it gentle.
And so with the rib that's torqued posteriorly,
Mm-hmm.
then the stretching is from the left,
Yes.
yes?
Yes. Yes. And what you will find, certainly not enough time for it today, but there's some what we call coordinated rib work that you'll do a lot of times with thoracic. Because what you'll find, one of the reasons I like to do the thoracic crawl, which was the one where I kind of crawled up their back and then crawled back down. One of the reasons I like to do the crawl is because you get to feel the rib heads when you do the crawl. And if you're pushing along there and one of the rib heads is sticking out, you feel it immediately. And you know right away, okay, that rib head is what's stopping the range of motion in that area. And then you can start to work on that rib head specifically. The rib work is pretty amazing in TuiNa because it's all real subtle and it's all based on breathing like Qigong, but allowing your body to manipulate itself while you're breathing, as opposed to me manipulating your ribs, which can be painful. I do a lot of martial arts, and so I end up with dislocated ribs and bruised ribs and fractured ribs and stuff all the time. And the adjustments that the chiropractors do on me are not comfortable at all. They hurt a lot and they create a lot of soreness over the next few days after you get adjusted. Whereas a lot of the TuiNa rib work is really subtle. And what happens is that more often than not, I'd say the majority of what you get out of the rib manipulations is de-inflammation. That the inflammation just immediately goes back down, and then that's usually why ribs won't go back into place, is because they're too inflamed. The intercostal space is too inflamed, and it just won't allow you to, to manipulate the rib. But as soon as you can get that inflammation calmed down, it's kind of just guiding the rib back to where it already wants to be, because your body knows what it wants. And that's part of what we're using in all of these things in TuiNa, is we're counting on the fact that the body's smart and it knows where it's supposed to be. Okay? If we didn't have, that, then TuiNa wouldn't work, because all of this stuff is based on us trying to find that, that body's neutral balance, and the body's working for that as well, and that's what helps us. All I have to do is kind of suggest where I think it should go, and if your body's doing its job, it's going to follow that. Okay? So we did pelvis, lumbar, thoracic. We are up to cervical. Questions?
Seated shear.
Seated shear. Those are upper thoracic. I'm going to skip those so we have time for cervical.
Okay.
That's getting into details. I showed one of the upper thoracics, which was thoracic compressions with the hands behind the neck. And that's your main upper. The shear is by far for everyone the most scariest of all the manipulations, because it does start to look a little bit like a velocity adjustment, like you see sometimes in chiropractic and osteopathic. And it's called the shear because the person's seated, you have one pressure here, and you're going like this, and it looks like you're going to shear the head off the top of the shoulders. So again, that one would take me a little bit of time to get you guys comfortable with.
No.
So let's go cervical. Who's my cervical guinea pig? Why don't you go right here, face up? That way I can borrow this chair. Okay, so what does it say for cervical? It probably says rainbow. Roll. Beautiful. So, to start palpation, all I'm going to do is get down into her upper thoracic a little bit. And then the same way that I was palpating along the spine, looking for soft tissue, any blockages. The best thing about this palpation is it just feels great. You won't have anybody arguing with you if you want to palpate their neck for a little while. Okay, that's fine. And there we get to the top. Okay, so she's definitely got more things going on her right side than on her left. A little more tension. I feel a couple transverse processes pushing out over on the left, on the right side too. C5, 3, 4, and 5 on the right. Maybe just a little bit on that. There's the trick. No, it's almost everything on the right.
Are you doing a circular motion or just going up?
Alright, that's all I'm doing. Just feeling.
You hurting there, Susan?
No, I mean, I just feel my SI totally torqued.
Okay. So now the rainbow. Right, number one, rainbow?
Yeah.
Rainbow, again, by far the subtlest of the cervicals. So, C5, right here under my right fingers. So the rainbow tells us that if I feel it on the right, and this is kind of the same concept as the leg swing, kind of same concept as the arm swing. If I feel it on the right, I go to the right, and I'm pressing on both sides of that vertebra, the right side and the left side. Before I actually do that, I mean, to the right, pressing with both fingers on both sides of the vertebra while I'm to the right. Okay, so she's to the right. Both fingers pressed. So what I'm kind of waiting for is underneath of my right fingers, there's that area, which was that first kind of area of tension. So I'm just waiting to feel a little break in that tension. The body starts to just open up and relax a little bit and starts to release. Muscles getting a little bit looser now. And there it goes. Now it's open. So I'm going to make a rainbow with my hands. Up and over. And as I come down the left side, I keep the pressure with my right hand, but I take the pressure off of my left hand.
So she has a little problem on the right side?
Exactly. And then I bring it back to neutral, and we feel that area. And look how nice and open that area is on the right.
Feel better, Susan?
You know, I didn't feel a huge shift, which,
No, you're not going to. No, you're not going to.
but I know that I'm constantly rubbing that area during the rest of the day.
So this is one more up. I would guess maybe C4-ish. Same thing on the right. Hold to the right. I got pressure with both fingers. My right and left fingers are pressing into C4. My right fingers, the tissue underneath the right fingers is starting to relax. And rainbow up and over. And down left side. Now I'm just holding her head with my left hand, still pressing into that vertebra with the right. And then back to the center. We got one more to go. I want to get 5, 4, and 3. And they're all on the right, so unfortunately you only get to see the right side.
I had a real backache, if you want to see.
You can be next. And up and over. See that nice big sigh she had as I was starting the rainbow? She let go of a lot of stuff in that sigh.
Oh, my neck is longer. Thank you.
So,
Yay.
I think so. So that's the rainbow. Go ahead and sit up for me, Susan. So, here's what my hands did without her there. They palpated. After I found some stuff on the right, I honed in on one of the vertebrae, and I took it to the right. Okay? Once I felt that the pressure under the right hand started to relax, I took it in a big rainbow, up and over to the left side. Left hand is holding and supporting, right hand is still pushing on the vertebra, and then I relax back to the center. Okay? Very subtle. Very subtle. You can do it as many times as you need to on the same vertebra. You can do it 10 times and it's not going to aggravate anything because it's very subtle. You're putting moderate pressure and moderate range of motion. Nothing that the body's going to resist against. Okay? All right. Next.
Actually, isn't it the weight of her head that's actually giving her
Yes.
like the fulcrum?
I am a huge fan of using the person's body weight to my advantage, as opposed to me having to use a lot of my muscle to try to get there in the same way. Now, any of these things where the person is laying face up and I'm putting my hands under, either for the neck, sometimes when we do the shoulder blades, sometimes when I even do mid and low back stuff, I'll do it from this position underneath. The only requirement, you have to have strong hands and strong fingers. Okay, you're going to have their entire body weight and your pressure going into them. So if your fingers aren't strong after the first minute or two, your hands are going to hurt, your hands are going to be shaking, so it takes a little bit of time, but you eventually build up strength in your hands and it feels comfortable.
And shouldn't you use a bolster underneath their knees if you're laying?
Yes.
Audrey.
Always get
A
them
little
in
bit
the
more.
most comfortable position that you can.
You want a bolster for her knees?
You need a bolster for your
I'm good, thank you.
She's okay.
Thanks.
Aha, we got a left on her. You get to see the other side. Okay, so we got low right, mid and high left. So she's got kind of a typical neck, which is a little bit of a zigzag. Okay. What's the second one?
Cervical roll.
Cervical roll. Okay. Cervical roll's the one that, after you're comfortable, that you tend to rely on because it's the easiest. Especially once you have the technique down. It's kind of like the lumbar roll. You know, it's like, I know I can get the things I need to in the lower back with the lumbar roll. I know I can get the things I need to with the cervical roll. It's also the cervical technique that most people feel apprehensive about because, again, you kind of feel like you might twist their head off a little bit. Okay, so cervical rolls technique looks like this. That's it. Really, really simple.
Now, is her cervical in between your hands?
Her cervicals are,
On top of it?
yes, resting on the edges of my index fingers. Okay? So, we start at the base of her spine. Real subtle. I'm not doing hardly any movement. Don't help me. There you go. Good. Very nice. Okay, now, when I find the spot that I really want, I just twist through it. And then I find the spot over here that I really want. And I twist through it. And you saw her a little bit of apprehension because, again, when you start twisting people's necks, they tighten up. And so what I do immediately is, as soon as that happens, I drop back to something like the rainbow. Okay? The rainbow won't make anybody hold on to their neck. The rainbow will make them relax everything.
If you haven't breathed when you're doing it, does it sometimes just take the mind off of it?
Sure.
And you forget what you're doing?
Sometimes I tap. Sometimes you'll see me get ready to do this, and you'll see me like kind of tapping on her shoulder to get her mind over here a second. Sometimes you'll even, just see me go like this just to bring her attention up here to her temples instead of back here to her neck. There's a lot of little tricks. I like to watch the chiropractors in that sense, and that a lot of them have great ways of working with kids. Chiropractor at my office, she tells the kids that she thinks there's some popcorn stuck in their body somewhere, and then she goes and she'll pop, and she's like, oh yeah, there was a piece. And the kids seem to really respond to that well, because then they're kind of like, oh, where's the next piece of popcorn? And they're kind of looking for it. So lots of ways that you can always kind of talk people into being relaxed. But the second that you see that any physical manipulation that you're about to do to the person is causing them to tighten up, you're already in the wrong spot. So drop back, go back to the most simple thing you can do in that area, and see if you can get them to relax. I'm going to go back to the rainbow for just a second for her. Although a lot of it's better, still a little bit upper left. So we've seen the rainbow on the left. So both hands pushing on both sides of the vertebra, tilted to the left. Up and over. And as I come down, the right hand is just holding now. Left hand still pushing. And neutralize. There we go. Now that left side's open.
Are you feeling vertebrae rotation when you're saying it's stuck on one side, or is it more?
A little bit, yeah. The transverse process is rotated that way, which means the vertebra is rotated that way. Now, part of the reason I also like to teach the rainbow first is because rainbow is one of the only ones that you can get the atlas and axis with. Cervical roll, it takes years to be able to get that high, to be able to get way up near the top of the neck, and to do a cervical roll nice and relaxed where you don't aggravate the patient at all. It can take you years to figure out. But the rainbow, you can do the first day you ever try it on the Atlas or Axis, and you got a pretty good shot of maybe it. Okay? So, you want to try to keep that in mind. She's got C1 on the left, which is why she was saying she had a neck ache. And it wouldn't surprise me if she had a little headache either. Okay, so this is real high, but it's right up here, right at the base of the occiput. Both fingers are pushing in on that C1. And I'm going to let her sit here for just a little extra time. Mm-hmm. And that stretch is helping this left side relax. And take it up and over. And hold for just a moment. And back to the center. Okay, left side feels great. Now, one little thing on the right side, right there. And what was number 3? Muscle energy, muscle energy, tension release, which is perfect for her. We'll just keep her right here. Okay. Almost everything is clear in her now. It's just a little bit of residual tension. So muscle energy stretch. You can do one side, you can do the other, you can do both in the middle. For her, we're going to start with her chin turned a little to the right hand under to her shoulder. So notice how that keeps her head directed at that angle. And now I'm going to push her head as far as it'll stretch on its own. When she's there, I tell her to push back slightly with her head against my arms. Go ahead. Good. And relax. I take it forward just a hair. Slightly back. Relax. And third and last one, not as much pressure this time. You're pushing. You're not overpowering me. And relax. Give it just a little stretch. And slowly let it out.
Oh, that was so good.
Now we're on the other side. Slightly tilted to the left. Left hand underneath. Hand supporting the head. Get to what I think is her maximum stretch at this point. I don't want to go too much further. That's perfect. She pushes back slightly. Yes, that was perfect pressure this time. And relax. Slight push. Relax. And last one. Relax. Good stretch, and you're out.
Are you moving your hand up on the shoulder at all?
Say that one more time.
When you do it from like one point to the next, are you moving your hand?
If you have to adjust to get yourself in a stable position again, yes. If you can keep yourself stable and anchored, that's probably best. But sometimes you notice she didn't have a tremendous change in her range of motion, so I didn't have to move that much. But the athletes, they'll push back the first time, and then when they release, their head's going to go like, way up. So yes, you're probably going to have to readjust hand and arm positions just to get comfortable again. Okay? And then the double, I put one hand under, I put the other hand under, and we push straight forward. She pushes back. That's too much, a little less. There you go. Relax. Push. perfect that time. Relax. And one more. Relax. Ah, there we go. Okay.
I've got emotion.